Unexplained physical discomfort. Unaccounted for physical symptoms like back pain, stomach aches, or tension headaches can occasionally be associated with depression. Heightened substance use. Some individuals might resort to alcohol or substances as a means of coping with emotional distress when dealing with depression. Alteration in personal care. Neglecting personal grooming and hygiene can serve as an indicator of depression. You may lose interest in attending to your self-care. Morning bedtime struggle. Encountering extreme difficulty in getting out of bed in the morning, even when there are no physical reasons to stay in bed, may suggest signs of depression. Cognitive distortions. Depressive thought patterns often entail negative cognitive distortions like all-or-nothing thinking, catastrophizing, and self-criticism. You may continually fixate on your perceived failures and shortcomings. Social and occupational impediments. Depression can hinder your capacity to perform effectively at work or participate in social activities. Meeting responsibilities and obligations may become challenging. Elevated risk-taking or recklessness. In certain cases, depression can lead to engaging in hazardous behaviors or taking risks with one's safety. Family history. A family history of depression or other mental health conditions might heighten your vulnerability to depression, particularly during extended periods of stress. Somatic symptoms. Some individuals experiencing depression may encounter physical symptoms such as aches, pains, and digestive issues that lack a clear medical explanation. It's crucial to bear in mind that experiencing one or a few of these symptoms doesn't necessarily imply the presence of depression. However, if you observe several of these signs persisting over an extended period, it is essential to seek professional assistance. A mental health assessment conducted by a qualified therapist or psychiatrist can furnish a definitive diagnosis and steer you toward appropriate treatment options. Depression is a severe condition, but with the proper assistance and intervention, recovery is attainable. The sooner you seek support, the better your prospects for effectively managing and conquering depression. Do not hesitate to converse with a healthcare provider or mental health expert about your concerns. Ruminating thoughts. You may find yourself constantly dwelling on negative thoughts, past failures, or perceived mistakes, unable to break free from this cycle of rumination. Loss of motivation. Depression can lead to a profound lack of motivation, making it difficult to initiate and sustain everyday activities and responsibilities. Increased sensitivity to rejection or criticism. You might become hypersensitive to criticism or rejection, even if it is not intended as such. Minor comments or actions from others can have a significant impact on your mood. Emotional numbness. While stress can be emotionally taxing, depression can sometimes lead to a feeling of emotional numbness or emptiness, as if you've lost the ability to experience a wide range of emotions. Psychomotor agitation or retardation. Depression can manifest as either increased restlessness, psychomotor agitation, or slowed movements in speech, psychomotor retardation. Changes in self-care habits. Neglecting self-care routines such as grooming, nutrition, and exercise can be indicative of depression. You may struggle to engage in basic self-care activities. Negative self-talk. Persistent negative self-talk and self-criticism can be a hallmark of depression. You may constantly berate yourself and have a low self-esteem. Feelings of isolation. You may feel like you're alone in your struggles, even when surrounded by people. Depression can create a sense of isolation and disconnection from others. Loss of enjoyment in relationships. Depression can strain relationships as you may find it difficult to connect with loved ones or derive pleasure from social interactions. Daytime sleepiness. Experiencing excessive daytime sleepiness, regardless of the amount of nighttime sleep, is another potential symptom of depression. Increased risk of substance abuse. Some individuals may turn to alcohol, drugs, or other substances as a way to self-medicate or cope with the emotional pain associated with depression. Worsening physical health. Untreated depression can have adverse effects on physical health, leading to chronic health conditions and weakened immune system function. Remember that experiencing these signs and symptoms doesn't necessarily mean you have depression, but they can be indicators that it's time to seek professional help and support. A mental health evaluation by a qualified healthcare provider can provide a clear diagnosis and guide you toward appropriate treatment options. Reaching out for help is a courageous and essential step in managing depression. Treatment options may include therapy, medication, lifestyle changes, and support from loved ones. The sooner you seek help, the sooner you can start on the path to recovery. Feeling overwhelmed. Prolonged sensations of being inundated by everyday tasks, obligations, or even simple choices can be indicative of depression. This can impede the execution of routine activities. Diminished creativity. If you previously found joy in creative outlets or hobbies, depression can stymie your creativity and enthusiasm for these pursuits. Excessive self-blame. Experiencing an excessive sense of guilt or holding oneself responsible for circumstances or events beyond one's control is a prevalent aspect of depression. Physical discomfort. Depression can materialize through various physical symptoms like unexplained discomfort, digestive problems, or alterations in appetite, which can result in weight fluctuations. Reduced productivity. Struggling with concentration, indecision, and a lack of concentration can lead to diminished productivity at work or in various aspects of life. Trouble initiating sleep. Insomnia or difficulty falling asleep can be an indicator of depression. Racing thoughts and anxieties can hinder your ability to rest at night. Heightened sensitivity to environmental stimuli. You may develop increased sensitivity to noise, light, or other sensory inputs, finding them overwhelming or bothersome. Avoidance behaviors. Avoiding people, locations, or situations that once brought you pleasure or engaging in avoidance strategies to cope with distress is a typical sign of depression. Episodes of crying. Frequent and uncontrollable episodes of crying, often without an apparent trigger, can be a symptom of depression. Physical lethargy. Depression can make you feel physically burdened or sluggish, as if it requires extra effort to move or complete daily tasks. Excessive worrying. While stress typically involves concerns about specific stressors, depression can result in generalized and persistent worry about multiple aspects of life. Relationship struggles. Depression can place strain on relationships, as you may withdraw from loved ones or encounter difficulties in forming emotional connections. Suicidal thoughts. If you are experiencing thoughts of self-harm or suicide, it is imperative to promptly seek help from a mental health professional or a crisis hotline. Keep in mind that encountering some of these symptoms does not necessarily imply the presence of depression. Nevertheless, when these symptoms endure and disrupt your daily functioning and overall quality of life, it is vital to seek assistance. Depression is a treatable condition, and there are effective therapeutic and intervention approaches accessible to assist you in managing and recuperating from it. Do not hesitate to reach out to a mental health professional or a healthcare provider for support and guidance. Feelings of emptiness. You might describe feeling empty, as if there's a void inside you, and a lack of purpose or meaning in life. Recurring negative thoughts. Persistent negative and pessimistic thoughts about the future can be a hallmark of depression, often referred to as a negative cognitive triad, involving negative views of oneself, the world, and the future. Changes in appetite. Depression can lead to changes in appetite, including overeating or loss of appetite. You may find comfort in food or lose interest in eating altogether. Excessive irritability. Feeling easily irritable or snapping at others more frequently than usual can be a sign of depression. Feeling stuck. You may feel stuck in your life circumstances or believe that you have no control over your situation, contributing to a sense of hopelessness. Increased risk of self-harm. Some individuals with depression may engage in self-harming behaviors, such as cutting or self-mutilation, as a way to cope with emotional pain.
Thank you for joining us in this captivating journey into the realm of the mind and its extraordinary capabilities. We hope you've enjoyed this exploration. If you're as fascinated by the magic of the mind as we are, and want to continue uncovering its mysteries, be sure to subscribe our channel here. Our next video promises to take you even deeper into the enchanting world of the mind. Be sure to click here. Until we meet again, I'm Eileen, signing off. See you in the next video.